Well, the heated debate continues about the U.S. President Barack Obama's Affordable Care Act, also known as Obamacare. Healthcare.gov, the federal website that serves as the insurance hub for dozens of states, got off to a very rocky start. It enabled many previously uninsured Americans, though, to access health care. But critics say it has fallen short in many ways. Errol Pierre is the Assistant Vice President of Product Management at Health First, and he helped us a lot as the Affordable Care Act was getting underway last year, and he's back to help us with this one-year report card. Good to see you. It's been about a year or so since we've seen you. Yeah, man, was it a rocky start, but did they finally hit their stride with healthcare.gov?
I would say definitely so. Since the launch, there's 8 million people that have actually gotten coverage. Many more have actually shopped for coverage. People are having these qualifying events, which means their income is changing, so they have to go back to the website to do changes. And so far, so good. The website's been working, and we're looking forward to, obviously, the second year with all the lessons we learned from the year before. The other good news is the federal government changed their vendor that they were using. So they used to use a Canadian vendor. They've since switched to a New York-based vendor, Accenture, which is supposed to be, better, faster, cheaper. So the website should be working better. So
now during this open enrollment period, when people go on, they should be able to get through the system without any glitches or problems.
That's definitely the hope. The only, and I'd say the caveat is now that we have 8 million people nationally that enrolled, we have to get them re-enrolled because the coverage was for a year, as well as the new people that want to enroll. There's 45 million people uninsured roughly before the ACA. That lowered by about 8 million, so more people will come in, and we have to keep the 8 million enrolled as well. So that's a nuance that we didn't have to worry about last year.
Errol, talk to us about affordability. That's been another sticking point with those who criticize affordable care, and that is that it does not really provide affordable care.
Right.
What have people been able to get?
Sure. So you have to look at it from two-pronged approach. One of the things that Affordable Care Act did was strengthen the state commissioners' right to do approvals. They could actually approve rates before they were released to members. The rate approvals by far have shown that, based on CBO estimates, 94% of the plans were lower than what the CBO thought they were going to be. So health plans actually lowered their rates to get into this exchange to try to get the new members, right? That's one piece. The other piece is there's lots of financial assistance, which wasn't there before. The number one reason people are uninsured is because they can't afford it. So the Affordable Care Act did financial assistance, which would lower the monthly premium, as well as lowered copays, deductibles, the amounts you pay to your doctors and physicians based on your income levels. So that definitely is working. It's cheaper to the member. I wouldn't say that you can tell if healthcare costs are cheaper overall, but what the actual person is paying is cheaper.
It's going to take a little bit longer to be able to see that. Because that's another point of the criticism
Right.
there, is that it's going to cost the government and cost taxpayers a whole lot more money.
Definitely. I mean, there's so many studies. So you look at Massachusetts when they first launched, the healthcare costs went up, right, because more people were accessing it. But in general, the jury's still out. We have to wait for the year to end, and then look at all the data nationwide and see what actually happened.
So then what about health outcomes? Are we able to measure those yet?
So it's early. One of the things that we saw was the enrollment actually doubled, but at the end of open enrollment, so people are procrastinators, they waited to the last minute. So since they got coverage starting in April and May, it's really hard to predict outcomes because we only had their coverage for a couple of months. So this is still very new. The membership is new. The trends are new, so we're still gathering data to see what's going to happen.
Particularly when the Affordable Care Act was first rolled out about a year ago, there were some tweaks made to the law. Will you just remind our viewers of the very basic tenets of the law and who it's available to?
Sure. So the Affordable Care Act is open to all documented Americans. Undocumented folks can actually get Medicaid in certain states. It is, if you have insurance, if you're paying more than 9.5% of your salary towards that coverage, you can get coverage. If you're uninsured, you can go on. If you're making below $45,000 as an individual, $96,000 as a family of 4, you can actually get access to these financial assistance to lower the cost of care. And it's really, all the plans on there are offering all the standard benefits. So you don't have to worry about if one plan covers something and another plan doesn't. If it's coming from the exchange, you know that all the 10, essential health benefits are covered.
Well, I'm sure there's a big sigh of relief in Washington that it survived the year. All right, Errol Pierre, thank you so much.
Thank you.
It's good to see you.
It.
All right. And you're watching Arise America.